We got feedback from our community and referring physician base. They were unhappy by the timeliness of us seeing new patients. We realized that it's the key to our growth is to see new patients. And more importantly, patients with heart disease who've been told they may have a heart problem want to be seen sooner rather than later. We had to change that, and we formed a group, a team, a HCV Access improvement team. We worked very hard to change our templates and our attitude towards seeing new patients.
The biggest thing that we did was really review the templates. We already had the physician buy-in to the need. We reviewed all the templates, and we made sure that there was enough new patient slots, and we actually froze one of the 2 new patient slots so it wasn't being accidentally booked into with established patients, that we were holding specific time for news. So we had our own scheduling staff, specifically the leadership for the providers, and of course the management leadership with Jay Sear and Theo Meyer and Dennis Ty and Jeannie Correo, and their admin staff over in the school, and central scheduling was a huge part of this work. So they do 100% of our scheduling now, and they are very involved in all the initiatives with the access and the changes of the templates. The next steps are to continue to advertise that we do have such good availability, so we will continue to fill our access slots. And we've talked more a little bit about chronic disease management and our 3rd next available appointments, and trying to be very accessible to our established patients. So we're looking at those metrics and trying to have a balance, a healthy balance for the chronic patient. We've looked at possibly decreasing the amount of schedule we keep on the books, because we've always kept a year out, and we find that our providers change a lot of schedules and the patients change a lot of schedules. And a lot of the comments are, patient traveling, and if they were more aware of their schedule, if we booked it closer to the appointment, then there would be less change for both providers' schedules, patients' schedules.
Well, I think we've reached a point where we can guarantee very rapid access. We also want to provide a different type of service to our referring base, meaning if a physician simply wants to talk to us about a potential referral, we have a back line set up that they can call us and talk about a possible referral. We have had a Department of Medicine survey, and they surveyed all the different divisions in terms of access: easy, not easy, nor poor, and poor. And we came out tops in the whole Department of Medicine. So our colleagues rate our access is excellent. Some of the access issues are not known outside of UMass, so we went and visited various practices to tell them about our access and guaranteed 24 to 48 hour access. Patients are grateful if they are seen early enough, and the obvious metric was, what is our lag days now? It was 21 days, it's close to 10 days now. I can say that I think that every section or division that wants to improve access needs a champion to drive it. People should feel passionate about this and make sure that they understand the value of seeing new patients. I think new patients is the fuel that drives our enterprise. So we have to buy into that and have champions driving it.
Access is something that we've got to focus on to stay competitive, that everybody wants to advertise that we're here for you, and we want to be here for Central Massachusetts.